the risk? What is the risk of adverse events from days of hotter weather? And we looked at both the variation in space, so across the Commonwealth, you can see that some communities are at higher risk than others. So this is the color code there represents the relative risk of an emergency department visit at on a day of 100 with a maximum daily temperature of 100 degrees versus a typical summer day. And so you can see that the relative risk in darker red is higher in some communities than other, and those communities outlined in black represent those that are identified by the Commonwealth as being EJ communities. And you can see that on average, EJ communities have a higher relative risk of heat-related emergency department visits than non-EJ communities. So the risk varies across space. It also varies depending on the population. On other population characteristics here, we show by age group. So we were typically when we think of who's at greatest risk of a heat-related event, we often think of older individuals, so 65 and over, but in fact, this is using the CHIA data from the state. And in fact, the highest relative risk was in the 5 to 17-year-olds, so the pediatric population. And middle-aged individuals adults from 18 to 64 were also not immune. So it's really interesting to think that maybe the groups that we think are as the most vulnerable, maybe we need to broaden that thought about who's most vulnerable. Next slide. So some of the takeaways is that there's profound heat impacts really across the population. There's, when you looked at the maps and the age groups, there's really nobody that's immune. And so this is really across the population, but some people and some communities are at greater risk than others. The increased risk does seem to be there, not just at 100 degrees, but sort of from say a typical summer day of maybe 80 degrees all the way up to the hottest days that we see. There's sort of a continuum of risk, and then multiple days seem to augment that risk. And our community, the participants really said they do value data, but then the question is, how do we make that data usable, despite obviously that it's complex, it's not always available, and even when it's available, it's not always accessible because of either technical limitations or privacy issues. Next slide. So some of the questions that emerged from that discussion were, how can we address the issue of municipal networks reaching, those that need to know? And so you can imagine different audiences, and we talked about different audience being sort of government officials at local government scale, but also community-based organizations and other organizations and institutions that are in positions of influence. You can think of like the school nurses, you can think of those operating nursing homes or other healthcare facilities. And so how can we reach broadly the different stakeholders in a way that's action-oriented and not duplicative or redundant across channels? How can we communicate the information that comes from the data, but in a non-technical way so that it's accessible to individuals and leaders? And more broadly, we do a really good job of issuing heat alerts of saying it's going to be really hot tomorrow or the next day, and can we start to assess how effective these heat alerts are at actually reducing risk or shifting people's behaviors? Next slide. So some additional considerations that participants identified is in the CHIA data that we have from the state that we've been, showed those analyses by place and by age group. Some of the other ideas that came up is, could we look at differences between where indoor versus outdoor occupations are prevalent, rural versus suburban versus urban communities, the impacts of different types of heat. So not every hot day is exactly the same, although in this region it tends to be hot and humid simultaneously. Other potential factors that convey vulnerability or individual susceptibility. And, can we look at, again, a number of neighborhood or individual level factors that make some people more vulnerable than others? Next slide. All right, so in the second town hall, and Kat, are you okay if I just keep going?
Yes, please.
Okay. In the second town hall, we really tried to frame it around two scenarios. One scenario was a scenario of extreme heat, similar to the Pacific Northwest heat dome that occurred in 2021, where temperatures were substantially higher than normal for that time of year. This was in the middle of June. And you can see there that the temperature anomaly, so like this means that some days were 15 degrees centigrade higher than the average maximum temperature for that time period. So substantially hotter than expected. And the analyses that have emerged from that is lots of extra deaths, lots of extra emergency department visits, lots of extra unplanned hospitalizations each day, and in the days following that, and that this actually impacted healthcare delivery. So there was, the measures of ED, emergency department crowding, and length of stay in the emergency room were, substantially worse than on non-heat wave days in the same year. And then again, not everybody was at the same risk. We had participants or patients that were older or women, and particularly those with pre-existing diabetes that were at substantially higher risk of a heat-related emergency department visit. Next slide. The other scenario we considered is just longer, warmer summers. So Zach Pop, who's on the call, showed us some data he's been working on to just show how much hotter it is in the region now than it was even just 20 years ago. And so you could see both in the New England as a whole and the Mystic River watershed area, so eastern Massachusetts broadly. And how much it's warm. So this is expressed as the 95th percentile of maximum temperature, which is equivalent to the 20th hottest day each year. And so, summers are just getting longer and warmer in New England. They're probably also getting more humid, but we haven't explored that yet. Next slide. And so some of the key takeaways from the discussion after that, so these two scenarios were like one's extreme heat and are we ready with the emergency response needed on those days? And the other is just sort of every other day of the summer that's just hotter and, for more days, like what are the potential response strategies there? What's working well? What still needs better investments in resources or approaches? And see these, I won't read them all, but here you can see sort of the key takeaways from the small group discussions we had yesterday on those days. So really interesting that there's still although the impacts of heat on local communities is widely known. Heat is bad, results in illness, discomfort, and occasionally death. That there's still, not really all the resources, insights, and in particular, what actions would help. One of the interesting conversations we have is that not all the actions that communities might be considering taking now are helpful, and they all cost money. So we need to sort of focus not only on better communication and better coordination, but better action, which might mean changing, giving up some of the things that we currently think might not work as well as expected. Next slide. So actually, Kat, why don't I turn it back to you for this one?
Sure. Thanks, Greg. Great. So that was an overview of the last two town halls that we had. And yeah, I just wanted to underscore one of these points here, talking about the need for regional coordination, but local heat interventions and kind of that, that fine line of personalizing and catering to each community, but also needing to share resources and capacity is important too. And I think that equity piece is really important as well, and something that should be, the center of a lot of our conversations. So, great. So I think, today is more discussion based. I hope that going over the previous two town halls kind of sets the foundation, if you hadn't joined, for what we had been talking about. And we're really looking to just build on that and see if there's anything else that came to mind for any of you, in terms of, do these takeaways resonate with you, or what's missing. So you're also welcome to add that to the conversation. But we do have some discussion questions, and I think we can just all stay in the main room and have one discussion together. So I'll read through the prompts, and then I'll stop sharing my screen and we'll put them in the chat, and then we can discuss. So the first question is, what makes it challenging to coordinate efforts across different agencies and with communities? So this is kind of talking about, different scales. How are we coordinating across agencies? And then if you're working at the community level, coordinating efforts within the community, starting with what's working well, what can we scale up, what can we share, but then what also are barriers to doing that. The next question is, what kinds of tools, support, or resources would help you be better equipped to tackle these challenges? And this is kind of, we're hoping to tease a little bit out both in the day-to-day needs, but also a longer-term capacity building need. What is that need there? And then a third question is, how can we improve access to critical resources and updates? Whether it's funding opportunities, policy changes, or best practices. What's working well, what are the gaps? So, we've shared in these town halls and at the symposium, we'll share more about resources that are currently out there, best practices, et cetera. But how can we, rather than hosting a symposium and kind of having these conversations, how can we best reach people with these resources? So I am going to stop sharing my screen.